And very good. Well, welcome everybody. This is our first virtual town hall with myself, Representative Tina Liebling, and my colleague, Representative Liz Boldon. We are really glad that you're joining us this morning. Thank you very much for that. And we want to let everyone know a little bit about how we're planning to do this here. And of course, thank you all for your patience. It is kind of a new thing for everybody to do this in this way. But we have, first of all, we'd like everyone to please stay on mute. Those of you who are Zooming know that that helps cut out the noise for everyone, makes it easier to listen. And we have received some questions beforehand. We're going to take as many of those as we can. If you, for additional questions, just to let you know that Representative Boldon and I will not be monitoring the chat, but we have here DJ Danielson, who's our staff from the House, who has agreed to do that for us and be our moderator. So he will monitor the chat for questions, but the main way we'd like you to give us your questions is through a Google Doc, which DJ has put the link to that into the chat. If you want to go there and add your questions. So that's how he will be monitoring for questions, and hope we'll get through as many of them as we possibly can in this hour. So this is, as everybody knows, a very unusual legislative session. I just want to start out by saying that I'm so honored to represent part of Rochester. I'm 26A. My colleague Liz will also do a little introduction of herself. Many of you know me. I've been in office for a while, and this is a very challenging time for everybody. It's a challenging legislative session. We've just finished 7 special sessions. There was really no break from the last one into the next one, all because of COVID, which has upended so many lives and pretty much impacted every single person in one way or another, some far more than others. So anyway, with that introduction, I'm going to turn it over to Representative Boldon and let her say a few words, and then we'll get started with questions.
Thank you, Tina. And thank you for all of you for being here this morning. I am Liz Boldon. I am representing District 25B, which is Northern Rochester. And for those of you who don't know me, my background professionally is in nursing, and specifically now in nursing education in the hospital setting. And so I am just so honored to be in this role and to have the opportunity to hold this seat. I feel such a responsibility given everything that's happening. And so really grateful to be here this morning and to hear from all of you and to be able to answer questions and have a chat. It's really important to me to have that dialogue and connection to folks across the district. And of course, that looks different now given COVID and needing to be safe, but grateful that we can do this in a virtual way and continue the conversation. So I look forward to the questions.
Thank you. All right, we're going to turn to DJ then to ask the first question.
All right, good morning, everyone. Glad to be with you all here today. Got a few questions on this topic, including one from the Rochester Olmsted Youth Commission, so we want to thank them for being engaged here on a Saturday. Is there a plan to introduce legislation regarding a statewide ban on conversion therapy and or a ban on the use of LGBTQ plus panic defense, quote unquote panic defense, in this current session?
Yeah, so I can speak to that, and Tina, feel free to jump in as well if you'd like. I know that this has been introduced in the past, and I have had a conversation with my colleague who is also a freshman, Heather Keeler, who is planning to introduce this legislation, which I am in favor of. We know that conversion therapy, I put in quotes, is not therapy. It's not a medically sound practice. It's actually traumatic and harmful for folks and is not something we should be doing in Minnesota. So there will be, I believe, legislation introduced later in the session about that, and I will absolutely be supporting it.
Well, great. Thank you so much, Representative Boldon. And just to add a little more context from the past on this as well, that we had hearings on this in the last session. I remember a very impactful hearing in the Health and Human Services Policy Committee. And we actually heard from people who are survivors of this practice. And this is something that no professional organization, or legitimate professional organization, recognizes as real therapy. And it is very harmful practice. And we tried very hard to get this to be banned in state law. And we were unsuccessful at the end. The Minnesota Senate just wouldn't do it. And we will make another try this year. And thank you, Representative Boldon.
Our next question, since so many Americans do not seem to know the Constitution or the Bill of Rights, why can't the test that is given to new citizens be administered to high school students? And then if they fail them, then they would have time to learn the facts.
I think that's an interesting idea. I think we certainly can have a conversation about that. I think we have seen, especially in the last few years, the danger of misinformation. And so I think there is an opportunity to, look at education and there's a few other topics I think that, would be helpful for folks. Things that I didn't necessarily learn in school that are valuable. And part of that relating to the misinformation is just, consuming information and sort of that critical thinking piece, and how do we evaluate information to kind of crack down on that, rampant misinformation that we're seeing, to be sure that people are getting and consuming accurate information. Other topics I think about too are, that would be helpful to be taught that aren't maybe consistently and always taught. And certainly things that I didn't learn growing up, but had to go out and seek resources for, is like things like financial literacy. And so I think there are opportunities to look at those things to be sure that we are giving kids the information they need to be successful in the world as adults.
Right. I think that's absolutely right on. And when I look at the question kind of more narrowly, just for what it's asking about using that particular test and administering it, I would be surprised if some teachers aren't using it as a tool already. I mean, I think it's a lovely idea just to use it to, it would just be fascinating. We should all check into it and see if we can answer those questions. It's never a bad thing to understand the Constitution and the Bill of Rights. But I think there is so much more, as Representative Boldon says, that we need to be teaching in our schools. Very, very critical stuff. Thinking skills, most of all.
Next question here. Please make clear your position on the urgency of climate and environment issues.
So maybe I'll go first on this one, Representative Boldon. I think this is so urgent. People are now referring to it as the climate crisis, which I do believe it is. And I am so grateful to see the Biden administration taking it as seriously as they are. But in the Minnesota House, we're also taking it very seriously. We have a climate caucus that I'm a member of. Many of us are members of, probably Representative Boldon is too. And we have a climate committee this year. And while I'm not able to do a lot of that work directly myself because I'm busy in other areas, I'm so thrilled that our team is working on this, and we should all be working on it because this is one of the enormous crises of our time.
I absolutely agree with everything Representative Liebling just said. I think this is, the climate crisis is just that. It is a crisis. It is an existential threat to all of us. And it absolutely needs to be one of the priority issues that we are doing work on. And I'm grateful that it is, as was shared, there is a committee dedicated to that, and lots of folks working really hard on that, as we need to, because there are many issues facing us right now, but if we don't have a planet to live on, then sort of none of the other ones matter, right? The other piece of this I think about a lot is, as a mom, I've got 3 kids, and I think a lot about the world we are leaving behind for them and their generation. And as I make connections with and have conversations with young folks across the district, more often than not, this is the top issue for them, and rightfully so, because it is their future. And young folks need us older folks to be doing this work and prioritizing this, because it is a crisis we need to take bold action on.
All right, so the next question, I think, is referencing the current peacetime emergency authority. When will legislators take reins for policies and rules? The governor has exceeded all logical limits of emergency powers, according to this questioner.
Okay, well, thank you, DJ. And I'm really glad to be able to address that. And before I do, I just want to remind folks, because I see new people coming in and we're moving right along here. So please do submit your questions to the Google Doc that's in the chat. Anyway, I hear this, this comes across in my email a lot. And it has been an extraordinary time. Obviously, we're facing a global pandemic. And I do believe that we are in an emergency. We've been in an emergency. And I think there's nobody who feels entirely comfortable with the way that we've had to rearrange ourselves to deal with the pandemic. But the premise of the question, which is that the governor's exceeded all logical limits, et cetera, there's a misconception that the governor is just running everything and making all the decisions. That's just not the case. In fact, the legislature's in session now, as you all know, and we are operating in many ways like we always have. But the problem occurs when you're in an emergency and things have to be decided quickly, and somebody has to make a decision. And the legislature is set up as a deliberative body. Legislatures are set up to be slow. They're set up to make the status quo kind of the thing that is, you have to show a reason to change the status quo in a legislature, right? And one example, we have a bill for a mask mandate in Minnesota during the pandemic, right? This is something people would say, oh, the governor shouldn't decide these things, the legislature should decide. Well, we have a bill. The problem is that to move a piece of really complex legislation, which this is, through the entire legislative process and get agreement from all parties that you need to, and then, by the way, the governor has to sign it for it to become law. This takes a very long time and it's difficult. And the default position is you can't do anything. So it is really important that the governor be able to exercise emergency powers. I don't care whether that governor would be a Republican or a Democrat. When we have an emergency, there has to be an ability to move quickly and put in place measures that are going to protect people. And I understand that because this has gone on so long, that a lot of people are really uncomfortable. And legislators are uncomfortable because it's not, this isn't what we like. We feel, all of us feel like, yes, we should have a hand in it. But the reality is we do. I have been working with and talking to the governor's office all through this entire pandemic. And I do chair the Health Policy, Finance and Policy Committee in the House, and I was chairing before the Health and Human Services Finance Committee. So I've had maybe a larger hand in some of this than a lot of other legislators have. But I'm in constant contact with the agencies that are working on the pandemic and with the governor's office. And there is a lot of back and forth here. But I do still believe that somebody has to make certain of these decisions. And the legislature's in session. We are doing our job. We are passing bills. We are putting together a budget. If the legislature wants to say the governor shouldn't be able to do X, Y, Z, we could pass that bill. So we are in fact in charge in the way that legislatures are able to be in charge. So I hope that answers the question. If there's a follow-up, please put it in the chat or put it in the Google Doc for DJ. Representative Boldon, did you want to add anything? Or disagree with me if you want to, actually. It's
Yeah,
fine.
I don't have much to disagree with. I just would echo sort of the comments of Representative Liebling there. I think, we, as much as we all wish we weren't, I think there's not one person who doesn't wish that this were over. Myself included, but it's not. And COVID is still very much a part of the environment we are in right now. I just looked it up this morning as I look it up most days, just to have a sense of what's happening. Overall, we've had over 6,000 Minnesotans die. And just yesterday, 28 Minnesotans lost their life due to COVID. And so, there still is community spread. There's now, discussions of these new variants. We are with vaccines, and I hope I think we will have a chance to talk a little bit more about that as well. We are on a path to being in a better place, but we are not there yet. We are definitely still in an emergency situation. And I agree that, the legislature is set up to be a slow and deliberative process on purpose, intentionally, and for good reason. But in situations like this, there is a need to do things quickly. And so there needs to be that partnership. And until there is a plan in place to be able to make those quick decisions and be sure that we are doing all the right things to be sure that we are keeping Minnesotans as safe and healthy as possible, which is, we are working on, and there's a plan for that. And I think we just need to continue to follow that process until that is sort of spelled out and we have a process for that. I think we need to stay the course and do our work to continue to keep Minnesotans as safe as we possibly can.
All right, next question here. What are the chances of recreational cannabis legislation advancing this year?
So maybe I can take that one too, because I have worked on that for quite a while. In fact, I actually introduced one of the first bills in Minnesota on this topic. The DFL caucus in the House is continuing to work on this, and we have a bill that has had a lot of work done on it that we will be advancing this year, as I understand. It's still a challenge, though, to get this passed because we have the Minnesota Senate, which is, as you all know, is Republican majority, and they do not have any apparent interest in taking this up. So this has been a struggle, as many of you know. In Minnesota, we don't have a process for initiative and referendum, so there's no way to bypass the legislature and just have a public vote on it like there is in some other states. And I think, wasn't it North Dakota just passed this by referendum? I mean, this is not a liberal or conservative thing. There are just so many reasons why continuing the prohibition on cannabis use by individuals is not a good public policy, and we need to change it. We need to do it in a careful way and make sure that we keep cannabis away from children as much as we possibly can, and have a regulatory uh, background to this that makes it as safe as possible for people, but that allows individuals to use this as they see fit. I mean, I think most of us understand that cannabis, while it's not completely harm-free, is a lot less harmful than alcohol, which is a substance that once in our history in this country, we tried to prohibit and not successfully at all, and finally had to repeal that prohibition. So I personally believe we would just be much better off to have a sensible system of regulation and allow people to make their own choices if they're adults. So whether it's going to pass this year, I mean, I think hopes are not high for that, but we are certainly going to make another run at it. Representative Boldon?
Yeah, I would agree with that. I think the fate of that bill remains to be seen for all the reasons that Representative Liebling just described. I think, as she also said, there are a number of reasons why we should be moving that forward, and we should make that happen. And we would not be alone. There are many other states who have already done this. And oftentimes, Minnesota, we are on the front end of things, and we are not on the front end of this. Many states are getting out ahead of us with this, and there's many reasons to do it. including this is also a racial justice issue. It's an economic issue. There's opportunities for the state, economically speaking. It would give us the opportunity to regulate it, where right now that does not exist. And so I am supportive of this. I think there will be continued conversations and work to move it forward in a safe and thoughtful manner. But I think, the chances of it fully passing, I think remain to be seen.
And just a reminder to folks, please put your questions in the Google Doc and DJ will read them out as we have time. DJ.
All right, next question here. Will you support House File 89, a ranked choice voting bill sponsored by Representative Elkins and Keeler to provide for ranked choice voting in statewide elections and the local option for all jurisdictions to use RCV if they wish? And the questioner notes that Rochester, with an even year election cycle, would need this bill in order to be able to consider it for our city.
Yeah, maybe I will take this one first. And thank you for this question, as this is something I like to chat about. So yes, I have signed on to that bill and I'm fully supportive. I think especially this is timely given what we are seeing with the attacks to our democracy. Ranked choice voting is, I believe, something that would strengthen that. It makes our politics more friendly, so to speak, that we see less negative campaigning when folks need to appeal to a broad audience, so to speak. And so I'm very supportive of this. I think it strengthens our democracy. It puts the power, the voice back in the hands of the people, which is exactly where it should be. I think, I think it's the direction we need to go. And I'm happy to support. And for folks who aren't quite sure about it or don't understand it completely, I am happy to chat about that. I know also we've got a very strong team in Rochester who is working on this and across Minnesota. So there absolutely are resources for folks to learn more about it, but definitely feel that it does strengthen our democracy and allows for voices from underrepresented communities to come forward. It removes the spoiler candidates from the equation. It allows people to vote for who they really want to vote for, with having to think about, is that person electable? So it kind of widens the voices that we hear in our politics, which is a good thing for all of us. And so absolutely supportive and hope we can move that forward. And I would also add, that is not necessarily a partisan issue either. It doesn't benefit one party or another. So I am hopeful that we can move that forward. Representative Liebling?
So thank you for the question. And, I agree with a lot of what Representative Boldon said there. I think ranked choice voting is really has a lot of promise for a lot of the reasons she said. I have to admit that the particular bill goes further than I'm totally comfortable with, because I would really like to see local governments be able to do this first to make sure that it works well in all places. And the particular bill opens it up, I think, to all the legislative races, to all the statewide races. And I frankly am not entirely sure that we want to go there like all at once. So I'm not gonna commit to that particular bill as it is right now, but I do think that that ranked choice voting holds a lot of promise for the reasons that she articulated very well. And I was kind of expecting a bill that would give all local governments an opportunity to make their own decision about doing this, because, let's face it, the mechanics of voting are really under scrutiny right now. And I think there's a real possibility for voter confusion. This is a big leap for people. And I think, it took a little while in the Twin Cities to kind of work out some of the kinks and people get used to it. And that's why I'm just a little bit more wary of that, but we'll see. I'm not saying I won't vote for it, but just not ready to commit here today.
All right, another question we actually have several questions on specific initiatives regarding voting and democracy, but here's a more general one. We have a unique moment to focus on improving/strengthening our democratic process. What should we look to achieve for Minnesota?
Well, we do have there is a bill that's been introduced in the House, and trying to think, is it 9? I don't usually memorize the numbers of bills, but anyway, we have a large elections bill that is now moving through the committee process, and it contains a lot of what I consider improvements to our elections process. We are a very divided nation right now, as everybody knows, and one of the super important things that we need is for people to have confidence in our elections. But I think what we've seen a lot of times is that the how we structure our elections um, is almost not as important to faith in our elections as what people are saying about it. And we're hearing a lot of people talking about our elections not being fair and safe and all that, really without any evidence. And that is disturbing because here in Minnesota, we have very free and fair elections. We've had a very good process. But some of the criticism in this last election came from the fact that things were opened up a bit more to allow people to vote during COVID. So I think it's important that we put those things into law. We see that people like to vote absentee. They like it, and it is very safe and secure. So I think that putting that more into law and allowing people to vote absentee and having it be more convenient for them while still maintaining the security of our elections is a really good thing. And I've had some emails from people who've said that, oh, absentee voting invites fraud and all that. Well, there are some states and some counties in Minnesota that only vote by mail, and they've been doing it for a very long time. So there is just no evidence that going to an absentee voting system creates problems in and of itself. People want to be able to vote conveniently. And to my mind, voting is one of our fundamental rights as not just as Minnesotans, as Americans. It's one of our fundamental rights. And so when we talk about make anything that makes it harder for people to exercise a fundamental right, there has to be a very good reason for that. And so far, I haven't seen very many good reasons to restrict any from people from voting. We should be making it easier for people to participate. We should be inviting them to participate. To me, that's what America is about. And Minnesota's been very successful in that. So I think we do need to codify, put into law some of these things so that they're very clear, so that nobody's worried about, oh, did a judge make a decision on it or did the legislature? This should be the legislature, the governor, putting more things into law that allow people to vote easily, securely, and I think we see that in some of these measures that are in front of the House right now.
Yeah, I would agree with that. I don't know that I have a whole lot to add with that. I do think it is House File 9, which is authored by my colleague, new freshman legislator, Emma Greenman, who in her professional life is a voting rights lawyer. So this is her wheelhouse. This is the work that she has done for years. And she is being a great champion for that bill, which I'm happy to support. I agree that voting is a fundamental right as Americans. Everyone deserves to have their voice heard and counted. In Minnesota, we have extremely safe and fair elections, and that has been demonstrated time and time again. Voter suppression is alive and well in America, and we need to make voting easier for folks, as Representative Liebling described. Voting from home, voting by mail. We saw in this last election, it was opened up because of the pandemic. We wanted to keep folks safe, but it is something that has been safe and secure for a long time in many areas, and we absolutely should be making it easier for folks to safely and securely make their voice heard. So I think there are a lot of good things in that bill. which do strengthen our democracy and make it easier for folks to safely cast their vote, because we want, again, this is not a partisan issue. It's an issue of having everyone's voice heard and everyone's voice counted. Something that we all should want. It's our democratic process, and I think that bill has a lot of good steps in it to do just that.
All right, a couple questions I'm actually going to combine here on healthcare. The question is, healthcare is gobbling up more of the state budget, yet not everyone is insured. What is the long-term plan? And then I suspect one or both of you might suggest House File 11 as a solution to that. So the next question is, what are the costs for House File 11, the Minnesota Care public option, and who will negotiate with the providers?
Oh, let's see. There's a lot to unpack there. Certainly, healthcare is gobbling up a lot of our national resources. Healthcare is expensive. There is no question about it. I would argue that we waste a lot of the resources that go into healthcare, and we waste them in unnecessary administration. And that we do have a lot of work to do to get this under control. In terms of the state budget, the, when you look at the actual numbers, a lot of the reason that, well, you have the cost of healthcare, period, that's growing, but you also have, especially in a pandemic when people have lost their jobs, you have more people who need healthcare because they have lost their job and don't have another source for it. And so if their income falls below certain levels, they're eligible for Minnesota's healthcare programs. There are some measures. I'm carrying a bill that's going to be heard next week that would save about $20 million right off the bat by taking the by changing a little bit the way we run our healthcare programs in Minnesota, our public healthcare programs. I won't go into the weeds of this, but by taking the right now we run a lot of our healthcare programs through healthcare companies, through health insurers, right? And not directly through the state. And this would take the pharmacy benefit and pull it back out and have the state run that portion of it. And we would save $20 million right there as a state by doing that. So there are things we can do to make this run more efficiently. Honestly, I've been pushing for some of these things for a very long time, but these are very powerful interests, and it's difficult to make headway, but I remain very hopeful as legislators get more educated about these issues that we're going to continue on this. In terms of the bill, House File 11, that's the Minnesota Care public option, we will see, we know, first of all, right now, we know that there are tons of Minnesotans who have to buy their insurance on the private market, individual market. They either are self-employed or, a farmer, for example. And that kind of insurance is so expensive and the deductibles are so high that it's like being uninsured. And oftentimes hospitals and other healthcare providers are actually kind of eating part of the cost because people can't pay the out-of-pockets, even though they're insured. So there's a big problem in our system, and the Minnesota Care public option is intended to provide a more affordable source of insurance for these folks so that they have a way to be covered. And I don't know about you, but I think everybody's entitled to have necessary health insurance, and I don't want to see anyone in Minnesota go without this. But there are people who are, and this is a way to approach it. So in terms of how it would be paid for, the formal fiscal process hasn't happened yet for this, but it definitely will happen before the end of this session. So I don't know exactly what the numbers will look like, but I do know that, I think there was a thing in there about who would negotiate with the providers. The way this is structured right now, it would, the people who are additional people who would be in the Minnesota Care program, either with some subsidy from the state or paying their own way as a regular insurance product, would be in the managed care portion of our public program space initially, where private health insurance companies negotiate with healthcare providers over how much will be paid for different services. So it would not be really that different than being in a regular insurance product. In fact, it might even be the same company for a lot of people that they would be in now with a completely unaffordable product. So this would give them an opportunity to have a better product that was much more affordable for them. So as you can tell from my short little quick answer here, this can get really complicated really fast, but I hope I addressed the question. And I know that Liz is working hard on all these things too. So please fill in, Liz, and anything I missed or that you want to add.
Yeah, I don't know that I think that was a great description, and I don't know that I have anything too much to add other than just to say that full agreement that everyone deserves to be able to have access to quality, affordable healthcare. We have work to do in this space because we know that is not the case right now. Also, over the last year, we have certainly seen that there are issues and problems when we have health insurance tied to employment. With all the folks who have lost employment over the last year because of no fault of their own, because of the pandemic, who then also lose their health insurance in a pandemic. And so, House File 11, that expansion of Minnesota Care, is not going to solve all of our problems related to healthcare, but is absolutely a step in the right direction to get more folks covered. And so I see this in my professional life as a nurse. I certainly have cared for folks who have put off care because they didn't get that preventative care because they didn't have insurance, and that just snowballs into greater issues and illness and sickness for folks down the road, which is not what we want for anyone. And so, definitely need to be taking these steps, and a very complicated issue to be sure, but necessary to be sure that everybody can have the care that they need in an affordable manner. So.
Great. And let me just add, the fact that this is so complicated, I view that as part of the problem. I really do. And anybody who has even Medicare, right? Young people think that Medicare is you get on it and everything's fixed. No, it's a complicated, messy, and expensive proposition to be on Medicare, even though obviously it's insurance that younger people don't have offered to them. So we've got a lot of work to do here. When you're sick, you should not have to worry about the bills. That's my bottom line sense. You should be able to get healthcare you need when and where you need it and not have to worry about the bills when you're sick. That's the bottom line. We have a very, very fractured system, and our pandemic has just showed us how really overcomplicated and really fractured and really unfair it is. So this is kind of the work of my career to try to make this better for folks, and it's a huge challenge.
I would also just add that it's a very opaque system. It's complicated and it's difficult and it's opaque. It's not a transparent system, and I think that is also part of the problem, and hopefully something that we can do something about. I know Representative Liebling, you've mentioned that before, and I know that you see that there's spaces where that could look differently and be more transparent.
All right. Some questions came in on the COVID-19 vaccine, so I'm going to just group these here together if that's fine. So what can be done to lessen the confusion on getting the COVID-19 vaccine? And then can you speak to the vaccine pilot? And also a question wondering how the vaccination rollout for those who live in special needs group homes and independent living spaces is coming along.
Yeah, great question. Maybe I will start with that and then toss to Representative Liebling to add. So I am grateful for this question because I think this is an important topic. And, the first part of it is how do we, lessen the confusion? I think one piece of that is putting out good information. So I have been trying to do that. And this is an opportunity to do that as well. So I appreciate that. So the vaccine is our path to, getting COVID in the rear view mirror. And so I would encourage everyone, when the opportunity comes to you to get the vaccine, to do so. It is safe. It has been researched and tested. And it is, like I said, it is our pathway to getting to the other side of COVID. In terms of the pilot and how that is rolling out, that has evolved a little bit. So a couple of weeks ago, for those who aren't aware, Minnesota announced a pilot. So there are 9 sites across the state, and Rochester was one of them, to trial vaccines for folks in certain categories. So childcare workers, educators, and folks over 65 years of age, as we are trying to target the vaccines, which are in limited supply right now, to target those to folks in higher risk groups. And so the first week of the pilot, there was an opportunity for folks to call in or go online to get on the list to get an appointment. It is by appointment only. And the limiting factor with this is the supply. We are getting our supply of vaccines from the feds, and that is a limited supply right now. And this is it's a pilot. The intention of this process is to kind of work out some of the kinks and get a process in place. So as our supply of vaccine increases, which it will, then we have a good process in place so we can get more people vaccinated. So the first week was a little bumpy, as there was, I think, over 1 million hits and requests for something like 9,000 vaccines. So, the demand is vastly outweighing the supply. The second week so they made some tweaks and changes. The second week went a bit more smoothly. They changed it to not a first come, first serve process, but had the registration open for 24 hours. So people could either go online or call in to request to be on the wait list to get one of the vaccines. And so within that 24-hour period. And then again, supply is still limited. Then randomly folks were selected from the folks who registered and were able to then make an appointment to get a vaccine. And so I am, really appreciative. Our folks at the Minnesota Department of Health and have been just working so hard over the last year with all of the twists and turns that COVID has taken. And so there is a process in place, and they are working hard to make the process as smooth as possible to get vaccines to the largest number of people possible. Again, we're currently limited by the supply, which hopefully will get better soon. I think certainly with the change of the administration, I think that is already looking differently. And then, of course, there's the logistics with the vaccine. We know currently the 2 vaccines we have, the Pfizer and the Moderna, require 2 doses. And so in the pilot, folks who get the first vaccine then are also making an appointment to get the second vaccine. And so I'll maybe stop there. I could talk about this for all day, and so happy to take other questions about it if folks have it. But there are really good resources out there at the Minnesota Department of Health and our COVID resources as a state. And again, would just encourage people to, as you have the opportunity to get the vaccine, to do so. It's safe and tested. Because of my work in healthcare, I have gotten my first vaccine, and I'm scheduled to get my second one in a couple of weeks. And so, yeah, I guess I will leave it there. Representative Liebling, things you would add to that?
Yeah, thank you. Just to say that, we have to all keep in mind that, first of all, I know that every single person, probably around the world, people are very frustrated. It's been a long slog. And I think we need to kind of focus on the perspective of what a miracle it is that we have the vaccine so quickly. Scientists have just stepped it up amazingly, and we're getting new vaccines. We've just heard there's another vaccine on the way. But there's a lot of pent-up frustration. Many people have been isolated, lost jobs, all of these things, lost family members over this, terrible worldwide pandemic, the likes of which we've never seen before, and the likes of which we hope to God to never see again. But so the perspective here is that there's been a lot of confusion, yes, and a lot of this has been, frankly, because we've had a lack of federal leadership up until now. And Minnesota did have a plan for prioritizing what we call vaccinating for impact. So knowing we had a very limited supply of the vaccine, Minnesota had a plan to try to use that limited supply to reduce death and reduce impact on people by vaccinating the people who were most likely to get the disease and to suffer greatly from it, to get to them first. And so hence the healthcare workers and people in congregate care settings. And this will go, someone had asked about other independent living and so on. So the point was to get to congregate settings because those are people who not only are more vulnerable to the effects of the disease, as we've seen a lot of deaths have been in those settings, but also because the virus spreads very easily in those settings and it's very hard to keep the virus out. Whereas many people are vulnerable to the effects but are living independently and are not as likely to be infected. So there was the distinction was drawn. Well, into that very carefully set up attempt, I would say, to prioritize with our limited supply, came the federal government to sort of throw a monkey wrench into it and say, okay, now open it up to everyone over 65. And then we found out very shortly after that, they didn't have the supplies that they had said they had. So we're in this really confusing situation, which, is somewhat inevitable, just given the scale of gearing up to give the vaccines to everybody and then not having enough. So my sense is that our state has really done fairly well. There hasn't, not to say we haven't had some big hiccups and problems, but the people who are working on this are they are just working full blast to try to get this thing straightened out, to try to distribute information, to try to get this going just as quickly as well as possible. And I've received some suggestions from constituents, people emailing me, which I deeply appreciate. I pass those on. They're appreciated by the Department of Health. So we did move to this lottery system, as Representative Boldon was saying. There are improvements happening. We're focusing now on school personnel to a degree to try to get our schools to be open, because that is, our kids are really having a bad time. I think we all know that, being out of school. And so trying to get that happening, trying to still focus on the most vulnerable. From what I understand, we're soon going to be through with that first 1A so-called group, and our long-term care facilities are almost finished in terms of getting a pass-through with vaccines, and that will free up more doses. So I think in the next couple of weeks, you're going to start to see more availability. There will be also an opening of places where you can get vaccines. So many of you will be getting your vaccine through your regular healthcare provider who will contact you. And I did read that Mayo Clinic is now opening it up to folks who are over 80 patients. So in my personal opinion, that's the right way to go, to start with older or sicker people rather than, saying anyone over 65. Because, just because we can't all get the vaccine. We have to start with those who are most vulnerable. So this is going to be happening eventually, and I hope very soon you'll be able to get it through your pharmacy, just like you get your flu shot. And as we get new vaccines that have easier storage and handling requirements, that will become more possible too. So what I would just say to everyone is, please be a little more patient. I know it's really, really hard, but this is a huge undertaking to get these vaccines distributed to everyone. I mean, this is, if you're reading the news about this and so on, this is, people are likening this to like a huge military operation. I mean, this is to vaccinate, what are we, 330 million people in this country or something like that. That's a huge undertaking. And in Minnesota, I feel really confident that we have the best professionals here and the best minds, and people are working on this night and day. So if you do have specific concerns or questions about it, please do email me or Representative Boldon, and we will, incorporate your comments.
Question here on COVID's impact on schools. Is it possible to consider halving class sizes in public schools and move to year round school to help stop the spread? Reducing class sizes is good for learning and helps protect our children from diseases. Also, the gymnastics that teachers are going through to keep our children safe is extraordinary. And as our children are our most precious resource for the future, can we give them a pay raise across the board? In addition, will schools be given additional resources to help handle the mental health crisis that is accompanying the pandemic?
That is a great question, and there's a lot packed into that. So I will start, and then let Representative Liebling add in as well. So thank you for that question. Um, so the idea of moving to year-round school to sort of lessen and decreasing class sizes, I think is an interesting one. I think there's definitely conversation to be had around that. I think, and firstly, I just would say with sort of a blanket statement of, in reference to the gymnastics that teachers have been going through for the last year to do the very best they can for their students, is so true. And I would just, share my gratitude and admiration and respect for all the educators who really have been doing gymnastics and doing their level best to create those environments where kiddos can still learn while they themselves are also living through a pandemic and oftentimes have kids of their own and are trying to balance all of those things. So, nearly an impossible ask of teachers we have done over the last year. And so I think in terms of, can we pay them more? I think that is definitely something to have a conversation about as well. Looking back to, the budget that we are tasked with this year in the legislature, I think, broadly speaking, a budget is a moral document and shows where our values and priorities lie. And certainly education needs to be a piece of that. We should be fully funding education, and we should be compensating teachers appropriately for the incredibly important, incredibly difficult work that they are doing. And certainly that is true all the time, and is absolutely has been true over the last year. In terms of the mental health piece that was asked about with our kids, we know that, this has been a really difficult year for kids. They are living through a pandemic, which, is just, there's a huge level of stress with that. Their entire lives and worlds have been disrupted. They're not learning in the ways that they normally would be. Perhaps their parents have lost work. Lots of difficulties for kids and lots of issues potentially with mental health. And so we absolutely need to be supporting kids through that and making sure that schools and teachers have the resources that they need. I think about one opportunity for that is sort of the wraparound services we have with some of our schools here in Rochester. I think there's opportunity to expand that. And absolutely, we need to keep this on the forefront to be sure that we are getting the resources that we need for those teachers to take care of our kids who are, precious resources, and we want to do the best for them as possible.
Well, that's a great answer. And I'm not sure I have a lot to add to that, except to say that I believe the governor's budget proposal does have an increase for schools in it. I don't normally work on this education side of things, so I don't know the details of that, but it's the year-round school piece. I think that's a fabulous idea, and I think that we, of course, do have a school like that here in Rochester, and I think that I'd love to see the school board expand that. I know it's been a discussion for years, but I personally think it's a great thing. Maybe not for everybody, but probably for more people that are being served by that. And I do think that we need to, we have a problem with shortages of teachers. And I think during the pandemic, we have an even greater problem that I think some teachers have decided to retire and so on. So probably pay is, this is a really super important profession for all of us. We want the best people to be in it, and you don't get the best people if you don't treat them well. So I do think that we need to look at teacher pay and make sure that we're rewarding teachers that in a way that shows how much we value them and how important they are to society. So I think I'll stop there. And there was a lot in that question. I agree, but thank you very much for the question. And I do want to tell people we are kind of getting to the end. And if we don't get to your question, or if you have follow up, please do be sure to email us.
Great. I think we got time for about two more. What is your position on increasing direct support professional wages? And what are some ways that you think you can help ensure that DSPs across the state, but especially in Rochester, remain in their job and decrease the consistently huge staff shortage in group homes and day training and habilitation facilities experience?
Well, maybe I can start on that one. And I'm so pleased that Representative Boldon is serving with me on these committees, both the Health Committee that I chair and the Human Services Committee that my colleague Jen Schultz chairs. And I'm so pleased that Representative Boldon is in there learning the ropes on this too. But this is going to be a big issue this year, increasing pay for direct support professionals. In the disability space or in the healthcare space that the state funds, a lot of money has gone into nursing homes, which is important because if you're in a nursing home, obviously you need good care and you need to have people working there and so on. But a lot of money and attention went into nursing homes, a whole lot less into other parts of our disability ecosystem, if you will. And most people don't want to be in a nursing home. They want to be in their home and have the assistance they need. Or, we want people with disabilities to be able to live in the least restrictive way and be able to have as much control as possible over their own lives, just like the rest of us do, right? And this is also the law. But in order to help this happen, we need to have this really important workforce to be able to help people stay in their homes. And it actually is a lot cheaper for people to have this kind of help and stay in their own homes than to be in an institution, a nursing home, or whatever it might be. So the way the state budget goes, these these wages don't go up automatically, and it is quite expensive as overall to be able to do this, but it is so critically important. I think this year there's gonna be a big push. There is a big push to raise wages. We also need to figure out a new formula for how this money gets to the people doing the work. That's been a big problem as well, because the way the state can appropriate money, but then how the money flows down to the people who are actually getting paid for doing the work is a pretty complicated and convoluted process. So yes, we need to do that. Yes, I'm absolutely supportive of it. And this is a key thing for all of our futures, honestly, because I really believe that Minnesotans care a great deal about the most vulnerable among us. We believe it or not, Minnesota is usually ranked very high when it comes to rankings of what we do for people with disabilities, and yet we know what huge challenges we have in our state, and that many people, and this is also, mind you, a racial equity issue, because many of the people who tend to get these services as opposed to others, or who deliver these services, are people of color. And so this is a win-win for us if we can raise these wages. It helps all of us when people have money to spend and when they can do these very important jobs and also support their families. So I'll stop there and let Representative Boldon comment.
Yeah, I don't know that I have a lot to add to that. I think that's a great answer. And I agree. Yes, we absolutely should be paying folks who are doing this really important and really difficult, honestly, work, you know, in a way that is, what they deserve. Everyone deserves to have a living wage, and this is important work, and we should absolutely be paying folks more.
Right. I think we'll conclude with this one. One word question, redistricting question mark.
Well, so from what I understand, the census data is not going to be available kind of on time. And this is going to throw a bit of a monkey wrench into it. We do have to redistrict this year. It will happen. What's happened in the past when we have a Democratic House and a Republican Senate is there's a bill. This is done with a bill, just like other bills, and the two sides probably won't agree. And then what usually happens is it goes to the courts, and the courts have a panel and they make a decision. So I wouldn't be too surprised if that happened this year. I'm not sure how the timing is going to work, but yeah, there's going to be some changes before the next election because we have to redistrict to make sure that we have equal districts with roughly equal populations. So it has to happen.
Yeah, I would just add to that I just think it's really important that is done in a fair and equitable manner, that, folks in elective office shouldn't choose their constituents. It's the constituents, that's the voters that should choose their elected officials. And so I just think it's really so important that is done in a fair way. And so committed to doing my part to using my voice to ensure that happens.
Yeah, so I think we're out of time, right, DJ? So I just would conclude by thanking everybody again for joining us. I hope you found this helpful to you. I'm sorry, I know we didn't get to all of the questions. And so please do reach out to us at our emails. They all follow the same pattern in the house. So if you look at our names on the screen, our email would be rep. And then our first name dot, our last name dot, or I'm sorry, our last name at house.mn. And I think DJ probably will put that in the chat. But we're easy to find, and love it when you reach out to us by email. That's probably the best way. And thank you again.
I would just echo that. Thank you so much for everybody who is joining. Really appreciate the questions and opportunity to connect with you, although it is virtual. But in some ways, that's good too. It just makes us more accessible in some ways. And so please do, if your question was not answered, I definitely want to hear from you. Please reach out via email or social media, and happy to chat with you about any questions that you might have. And I look forward to doing this again.
Absolutely. And thank you to DJ for your assistance here today. Bye.